Vestibular therapy is one of the most challenging types of therapy that we can do after a concussion, and it's the one that generally kind of gets a bad rap when it comes to concussion patients when they hear the word vestibular therapy during their concussion treatment. One of the most challenging aspects of vestibular therapy is we are focusing on the head movement, the eye movement, the body movement. It is the one that will generally be the hardest on you physically, mentally, and emotionally. Now, the research tells us that only 30% of people on average will get better with strict vestibular therapy only. But it is one of the widely accepted treatments for concussions because of the relationship between treating vertigo with the eye and the inner ear. And it's one of the most challenging things that we can do during our concussion recovery. Their cognitive therapy is one of the most intense ways that we can help on the scary side of concussion recovery. The reason I talk about cognitive therapy a lot is physically, you can kind of navigate through your symptoms. The cognitive side is scary for patients. I don't understand it. I don't get it. I don't see it. I don't know why yesterday I could remember where my grandchildren were, but today, why I showed up for a therapy appointment on a Wednesday and Friday, why I couldn't figure out that, hey, I don't know what to have for dinner, or I don't know what to have for lunch, or that I forgot that I picked up my dry cleaning already. The cognitive side can be very scary for patients. When I'm working with patients, I will touch on the cognitive side a lot throughout our concussion recovery because it is an area that is scary. If I can offload any treatment, the first person that I am going to try to pull into working with a patient that's trying to get the full package through the Midwest Concussion Clinic, one of the first things that I am doing is I am bringing in a speech language pathologist to help us out. It is one of the more challenging and complex parts, and it's not only trying to help you figure out compensation techniques and things that you can do to help aid the memory, but it's also helping try to reconnect those neurons to make it so the memory deficits and the cognitive deficits are no longer there. Cognitive therapy and vestibular therapy are very hard on the system. Even healthy, they can make you feel drained and run down.